You are listening to the Fire Rescue Athlete Podcast with your host, Aaron Zamzow.
Hey, all right, FRF Nation, Aaron Zamzow here with the Fire Rescue Athlete Podcast. If you're watching us online, firerescuefitness.com. Today, we're going to talk about the COVID-19 vaccine, and I'm contacting and reaching out to the smartest person I know. I went to college with this guy, and when I was out doing different things, he was in the labs. He went to Harvard. He got his PH.D. studying this stuff. So when I had questions about the vaccine, first thing I did is I reached out to my good friend, Dr. Jeremy Stewart. Now, I've never called him doctor until just now. I think once or twice I maybe called you that in the bars, and that was for a whole other reason. But it doesn't take away from the fact that you've lived most of your life in a lab. And I called you about 2.5 weeks ago, and I said, Jer, I am up. I'm a first responder. I'm up for this COVID-19, this vaccine. What do I need to know and why? And you told me this.
Yeah, exactly. I told you that, first of all, I'm jealous that you get to take it before me. Of course, you are first. But I think it's absolutely appropriate that first responders and people in the health medical industry need to take this vaccine. It's really important that they do. A lot of this has to do with trust. I think if you boil it all down, a lot of this has to do with who do you trust? I'm a scientist. I've been a scientist my whole life. That's my identity. I know a lot of other scientists. I know how this stuff is sort of how it works. I know the biology of it. I know the manufacturing process. And I also know the regulators who are involved. So it's a lot easier for someone like me to have that trust as opposed to John Q. Public, people who just don't have that familiarity.
Right.
So that's one big part of my recommendation, personal recommendation to you to take this as soon as you can. And it really kind of just branches out from there. I think, we can dive into all the science and things like that, but I think when you boil it all down, it really comes down to the trust and the familiarity with the amount of work and regulation and knowledge that goes into the development of not just this vaccine, but any vaccine.
Well, let's talk about that, because the first question that comes up in firehouses is that this has been fast tracked. This vaccine has not gone through the regulations and the rigors that a normal vaccine would.
Well, it has been fast tracked. There's no doubt about that, but there also haven't been any corners that have been cut. So we have to be very careful how you define fast track, and I think that's where a lot of the communication comes in, in terms of how we say things. The name of the whole name of the project was Operation Warp Speed.
Yeah.
I hate that name simply because it tends to make people think that, oh my gosh, they're just doing this way too fast, right? I understand why they named it that, but I think it was just from a public relations perspective, I think that was not the best name to use. So
yeah, why did they do that? What made this such a fast track thing?
Yeah, who knows? I think what's really important is we understand what was sped up here. Okay.
Yeah.
So normally, when a company or public entity, when they make vaccines, what you have to do, of course, is you have to test it, right? You got to make sure that it's safe and effective, right?
Right.
If it causes more problems than it prevents, then it's useless. It's actually harmful, right? So what manufacturers do is they work with the FDA. They go through what are called phase 1 through phase 3 trials. Each phase has a particular purpose. And when you get through phase 3, when you prove its effectiveness, that's normally when the manufacturers start mass producing the vaccine.
At phase 3.
Yeah, you don't want to invest millions of dollars in making your vaccine before you know it works, right? So one of the big differences between what's happening now versus what's happened in the past is that the government has given these companies money now just to say, listen, before, while you test it, make it at the same time.
Okay.
Because if it is effective, then we'll have millions of doses right away.
Right. And if it's not, we eat that, right?
Exactly. If it's not effective, if it doesn't work, then you're not out any money because we gave it to you. We essentially gave you that money to do the manufacturing, so you're not out, that amount of money. So that's one of the big things that is making this go so much faster. Now, the part where you test it, the part where you actually have to test the populations and to see if it's safe and effective, you can't speed that up, right?
Right.
Crops only grow so fast, right? There's some things you just cannot speed up. So they had to go through that, and they had to take the time to do that and do that correctly. And that's the part where the FDA, they're not going to bend on that. They're not going to make special allowances just because there's a larger need in the population right now.
But how do you know that?
How do I know that?
Yeah, how do you know that? Yeah. How do you know that?
So it's all documented. If you actually go to the FDA or the manufacturer's website, the FDA has kind of like a playbook for this, right? I mean, this has been going on, this has been happening for years. Vaccines have been around for a while.
Right.
It's a playbook that you got to play by. And you have to document each phase and the results, and then you're allowed to go to the next phase. And then you're allowed to go to the next phase after that. And all of that is public domain. So the companies are required to talk to the FDA throughout this process and publish their results. And they're only allowed to go to the next phase when they've proven the results from the previous phase. And so, all this is documented. It's available for the public to take a look at. It's just, I think what's lacking is that it's not obvious to the average person in terms of where do I go to look. Yeah.
And so, how do I know, these FDA guys, can they be influenced? In your experience, have you ever seen that? Can they be influenced? I guess I don't have any knowledge of what these guys are like, but I mean, you obviously, right? You do.
Yeah, I do. And I think this is where that familiarity, where somebody on the other side of that, that's where it really helps. Because I went to graduate school with, I went to school with him, and we spent years together in the lab. And then he went to the FDA. He decided to become a career FDA person, and he's a senior official now at the FDA. I think what you have to remember is that these are people just like you and me, right? These are people who go to work, they punch a clock, regardless of who's in office, whether it's Republican or Democrat or this president or that president, it doesn't really affect them. They're there to do a job. And if your job is looking at clinical trial data, that has nothing to do with who's in office. And just like you or me, we have a certain level of integrity when we do our work, right? We're not going to fake stuff in order to get the job done. They're not going to do that either, because it's something that they've been doing for years, and it's completely agnostic of who might be in power or how great the need is. They don't get paid more if they don't approve a drug.
Yeah.
Right. They don't get paid less if they let a drug. It has nothing to do with their day-to-day life.
So this is what they do, right? This is what you do. You right now. Your company is actually testing for coronavirus, right?
That's right. So
in a way, you doing this is putting yourself on it. But by you actually, you back this science so much that you're willing to promote it to almost put your company out of business. I hope your CEO isn't watching.
Don't say out of business.
Yeah, right.
But certainly. Yeah. So, right now, my company does a lot of COVID testing. We didn't plan to. It was just, we were approached by our local hospital and who needed a lot of help. They said, listen, we're getting 8 to 10 day turnaround times for test results. Can you please help us? And we said, absolutely. But yeah, you're right. As a vaccine, when this vaccine fully gets, available to the public, testing will go away. And while
if people take the vaccine.
If people take the vaccine, exactly.
Right.
And so, regardless of that, there's a greater public health good here that needs to be, my bottom line doesn't even compare to the effect on people's lives if they take this vaccine. So look, I'll be fine. The company will be fine.
Doctor.
You don't go into science. You don't become a scientist to make money. You do it for other reasons.
Yeah.
Right? You don't hear about, a guy, John Q at the lab bench who is a billionaire. It's just not why you do it. There's a greater purpose and higher purpose here. That's
especially now, before we get into that, greater purpose, because I think that's also important. The other question that a lot of people have when you talk about the science, the science behind this vaccine, can you give me the rundown of it? Now, you explained it to me really well. You know, like I like to say, like, give me the Forrest Gump approach to what this vaccine is. And this is a new technology?
Oh, so you're referring to the mRNA vaccine?
Yep.
Yeah, okay, sure. So yeah, it's a newer technology. Now, it's not completely new. There's a lot of research that's already been done into these types of vaccines. So I want to make that clear.
Has it been used before?
No, it hasn't been approved. It hasn't been approved by the FDA in the United States before. So that in that sense, new. But there are other vaccines like this for other viruses. So Zika virus, herpes virus, those are the rabies virus. Those mRNA vaccines have been developed for other viruses.
Okay.
This is the first widespread approval of an mRNA vaccine in the United States. And the way that it works, I think the easiest way to explain it is, you know, vaccines, they all kind of do the same thing. The idea is to make a piece of whatever you want to be immune to, right? So if it's the COVID, what you do is, the idea is to expose your body to a piece of it, not the whole virus, because you don't want to make yourself sick.
Right.
A piece of it that's harmless, right? So that the next time your body sees it, it will remember. The antibodies will recognize parts of the protein, and it will be able to respond a lot faster, right?
Yep.
Now, usually in order to do that, if you go all the way back to modern medicine, mothers used to take pustules, like little open, like pus from people who had smallpox, and they used to scrape their children's skin with that, so that was inoculating their children.
Oh, wow. Okay.
I mean, those are like the very first vaccinations, you know, that used to go on. Nowadays, with modern medicine, of course, we can just manufacture proteins from a virus or a bacteria and make vaccines that way, right? It's much more controlled. It's much more scientific. This is really doing the same thing, except what's even more clever is that instead of making the actual part of the virus, you're introducing this, what's called mRNA, and it's a message. It's a message that tells your own cells in your body to make a piece of the virus.
Okay.
So your own muscle cells, they inject it into your arm.
Yep.
And in the muscle cells in your arm, and the muscle cells are given this message by the vaccine. And then your own cells manufacture the protein itself from the virus, just a piece of the virus. And that way your antibodies can say, well, that doesn't belong in your body. Let's get rid of it. So that the next time, if you truly get infected, they'll know exactly what to look for.
Right. So the coronavirus produces this protein, and our bodies already know how to fight it. So we basically kill that protein, and the coronavirus can't grow.
The only difference between this mRNA vaccine and traditional vaccines is that it's actually giving us the instructions, your own cells, the instructions to make that protein, instead of making it in a warehouse and then introducing it.
So that leads me to the next question, which a lot of times people have. Well, there's so many different side effects of this. Then, like somebody said right away, oh, it's going to cause infertility. It's going to cause Guillain-Barré syndrome. All these different side effects come out. And what does the data show you? What do you find? As a scientist, you look at it and go, oh, what?
Yeah, exactly. So that's exactly what these trials are designed to uncover. That's why you have to test it first, right? Mm-hmm. So, for example, the Moderna vaccine, I think that had roughly 25,000 people involved in the initial tests in the phase 3 trials. And the idea is to say, okay, let's give this a wide dose, let's give a sample of the population this vaccine, and then observe them very carefully to see if there are any side effects, and document those side effects. Mm-hmm. So the current side effects, what came out of those trials, is that some people, you'll get redness and swelling in the injection site.
Right, like a normal shot.
Right, like a normal shot, like a flu vaccine. You may get a fever. You may feel lethargic. You may be tired that day. Things of that sort. Now, it is rare.
I'm a first responder. I've been tired since March, brother.
Yeah, there you go. Exactly. Yeah, me too.
Yeah, you too.
So now, in some cases, there may be allergic reactions. Some people are allergic, have severe allergic reactions. And so if you actually look at every time, I don't know if you've ever taken medications, you'll get a little information sheet that goes along with the medication that tells you. Yeah. Exact same thing with the vaccine. And so those instructions will say, tell providers, tell physicians, have epinephrine available,
Yeah.
steroid
Yeah.
shot available in case there is an allergic reaction. It's very rare, but that's true of any vaccine.
Yeah.
You may have
almost any medication is like that too.
Exactly.
You don't know, right?
Peanut allergies, right?
Yeah.
So those are kind of some of the observed side effects that have been seen with this vaccine. It's very similar to other vaccines. So
what about like the infertility thing?
No, I don't. So I looked at, there have been some social media reports of infertility, and there was a particular quote by I think a doctor who spoke about the vaccine. So the way that the vaccine, I don't want to get too technical here, but the vaccine is designed, the part of the protein that it tells your cells to make is called, a part of it is from what's called the spike protein of the virus. It's just a part of the virus. Now, there's another protein in the reproductive system of women that is similar but not the same to that virus protein. Okay, and the postings on social media said that since there were similarities, that may cause your own immune system to attack your own those cells, but it's really not the case. It's really not true. It just doesn't work that way. First of all, they're not that similar. It's the closest thing, but they're not that similar. It'd be kind of like determining, like I can tell the difference between a Ford truck and a Chevy Cabriolet. They're both cars, but they're very different.
Right. One's a truck and one's a car, buddy. I can tell you've been in the lab for a long time, but that's okay. I get your point. That's a good point.
There you go.
Yeah.
Yeah. It's that sort of thing, and so unfortunately, those are the kind of things that can easily take hold, especially with the advent of social media.
Yeah. And real quick on that, right? Like everybody thinks that somebody is going to get rich out of this, and that all these social media and all these different articles they're all motivated by money. But you made a point, you're like, a lot of these companies already got paid. They're getting paid regardless. So it just kind of dawned on me, like, so why if their vaccine doesn't work, they're not going to put it out there because that could be more detrimental to the company, right? Because they're already got their money.
Yeah, look, there's money to be gained for these companies, and no doubt about it, but you have to look at it both ways. Let's just take the worst case scenario. Let's say they did sweep something under the rug. Right. Let's say there was some ineffectiveness or some actual harm to the general public because of the vaccine, and it wasn't revealed ahead of time.
Yeah, and you didn't find any of that from the data, right? Like you didn't see any, right? So
no, not beyond the typical side effects that people with any vaccine. This type of thing, I think you said it best in our earlier conversation. This is the Super Bowl of vaccine developers, right? This is the Super Bowl of regulators. If something like that actually happened, it would destroy the whole industry for years. I mean, who would ever want to take a vaccine after that? Any vaccine. Forget about the COVID vaccine. Who would want to take MMR, vaccines, or the flu vaccine? And so, the companies have to really take that into consideration, the big picture here. By hiding any data, by faking any data, you're going to destroy any chance of future vaccine development for decades.
Right. You destroy that trust, which is what you really started with. Like you said, that's why trust the scientists here, right? Like
that's right. Which again, we come back to that. It all comes back to that. And so the companies, the vaccine manufacturers, they are keenly aware of this, and they have to think about their future over the next, not just this quarter or next year, but far beyond that. So they're not motivated to hide any of this. As a matter of fact, I told you of a story where there were some differential effects of vaccines, and that's already been made public. So no one's hiding anything here.
Good. And do you trust the data?
I do. I trust the data. I trust that it's being made public. I trust that it's being reviewed, that the FDA, the CDC having independent meetings to review the data. I always like seeing when there are arguments.
Yeah.
You know, when scientists and regulators have arguments, that means that it's really being tossed around.
Yeah. The what ifs are coming out, right?
What's that?
The what ifs are coming out.
The what ifs, and hey, did you think about doing this? Or, for example, there was a debate of like the current vaccine, the one that is that you'll be taking fairly soon.
Pfizer.
The Pfizer vaccine.
Mm-hmm.
You know, there was a debate on what's the age cutoff. You know, which ages and above should be, and some people dissented. You know, there was a debate with whether the cutoff should be 16 and over or 18 and over.
Mm-hmm.
And some scientists said, no, it should be 18 and over. And others said, no, there's enough data to say 16. The point is that the data was reviewed, it was debated, it was discussed, and a recommendation was made. And I always like seeing that.
Yeah, from a scientist standpoint.
Yeah.
And I know, like, some of that stuff, I tried to look at it and it's boring. I can't understand half of it. And again, that's why I went to you, and I can't thank you enough. You know, is there anything else that you would add? You know, if any questions that you had or that you're getting from people? I mean, you know, for me, listening from someone like yourself, like, you know, what I didn't touch on and I didn't want to bore people with is that, you know, you got paid to go to Harvard, get your PhD and study this. And, you know, when you got out of school, you've really made a great name for yourself. And again, your company right now is doing COVID testing. And as much as I picked on you, you know, I mean, I give you all the product. You were always in a lab, and this is your Super Bowl. And I can't thank you enough for taking the time to talk to me and, you know, the FRF Nation. Hopefully some people got some great stuff from this, but is there anything else you wanted to add to the conversation?
Yeah, I think so. I think if, you know, what I try to tell people, and this is the same things for wearing masks, and the same thing argument is for the vaccine, is I really think about this stuff as being good to your neighbor. You know, when I wear a mask, I'm not just protecting myself, I'm protecting everyone else around me, or at least attempting to. I think the vaccine is the same story. You guys have probably heard in the news the whole concept of herd immunity. Yep. And how when you get to a certain point, the rest of the population is protected. And so it's the same idea here. I think, you know, you're a firefighter, Aaron. So I use the analogy of, you know, to prevent a fire from spreading, you want to have wet timber all around, right? Something that's wet, it's not going to spread. A person who's vaccinated is the exact same as that wet piece of timber. You know, they can stop the spread, at least around them. Yeah. And so I think it's actually, you know, I think it's a kindness to do this. And I understand the concerns. I really do. I understand that there's you know, with social media and the public discourse these days, it's hard to trust. I get that. It's easier for someone like me to trust because I'm just more familiar with the data. I know where to go. I know a lot of the people. You know, I hope that our conversation today can instill a little bit of trust, because I really believe with my whole heart that, you know, this vaccine is the right thing to do, that it's safe, that it's effective. And if it's not, if one comes out, there's multiple vaccines in development. If it's not, we'll know about it. Yeah. We'll know exactly, you know, that data will be revealed. It won't be hidden.
Or it would have been already. I mean, there's some companies that probably have dropped out and have.
Oh, yeah. Oh, a great example is there's a whole, a large vaccine trial in Australia, and that trial was stopped. It didn't work, you know? So yeah, I mean, trials get stopped all the time. They do. You know, to develop a drug or a vaccine through all the three phases it's hard. You have to have a good product, and so it's not uncommon for these types of things to drop out. And if it is, then it's better. Then we're all better for it, because that the process exists for a reason. So.
Well, thanks, buddy. I think that addresses the biggest concerns right now. And maybe in a couple of weeks, if you wouldn't mind coming back doing a follow-up. I know people are going to continually have questions. I can only send you so much gear, so maybe 2 interviews, maybe third. You know, I can't bribe you too much with things. But, you know, Dr. Jeremy Stuart, thanks so much for your time. FRF Nation, if you do have questions, reach out to me and I can contact Jeremy, and we can address some of them as these continually develop. But I think he hit it right on the head. You know, one of the best ways to stop the spread is through wearing masks and getting vaccinated, especially those in the front line. And, I'm on board. Are you going to get vaccinated, brother?
Oh yeah, as soon as I can. I've got a good friend of mine. He's an oncologist. He's getting vaccinated on Friday. As soon as I get the notification that I'm in line, I'm going to do it.
All right. Well, I think that says a lot too. So thanks, buddy, for the time. You're the best.
All right. Thanks, Aaron. Take care.
See you, buddy.
All right.
Thank you for listening to the Fire Rescue Athlete Podcast with your host, Aaron Zamzow. Please tune in again soon for more fitness tips for fire rescue athletes.